I know there's a lot of concern around the country about the situation here around swine flu and the situation going on in Mexico. I hope this afternoon to share with you the current status of our investigations and the work that's going on both here and around the world to understand this better and to control this outbreak of swine flu. This situation is evolving very quickly. It's changing quickly. And so you will continue to hear information that seems in conflict. You'll see numbers in one place that may be different from another. Today I'll give you the numbers as we have them, but ask you to focus a little less on the specific numbers and more what it tells us. What we learn from the numbers is how disease may be spreading and where it's not spreading. It tells us some about transmission, and I'll share that information with you. We continue to approach this investigation and our control efforts aggressively. That's because you don't know going into an outbreak what it will look like in the end. And we want to be aggressive. We want to take bold action to minimize the impact on people's health from this infection. So where are we today in terms of cases? We are officially reporting 40 confirmed cases in the United States in 5 states. These are the same states that we reported yesterday: New York, Ohio, Kansas, Texas, and California. The only change in confirmed cases from yesterday is 20 additional cases in New York City. These are associated with the same school outbreak that we talked about yesterday and really represent additional testing in that group, not an ongoing spread of that cluster. Of the 40 cases, we are only aware of 1 individual who was hospitalized, and all people who've been infected and were sick have recovered. The median age is 16 years, with a range in age of 7 to 54 years. And as I've been trying to stress, as we continue to look, I expect that we will see cases in other parts of the country, and I would fully expect that we'll see a broader range in terms of the severity of infection. Thankfully, so far, we've not seen severe disease in this country, as has been reported in Mexico. So far, CDC has confirmed 26 cases in Mexico, but clearly from the reports coming out of Mexico, this is a small fraction of what they're seeing. These are the number of cases that we have confirmed here in our laboratory. I want to talk about some of the public health actions that CDC has taken and that state and local public health are taking and that the global community is taking. We continue to work with state and local public health to investigate and understand what's going on. We're continuing to provide support in the laboratory testing that's taking place. And as we investigate, we'll continue to learn more about how this disease, how this infection is transmitted, and how it can be prevented and controlled. We're working with the World Health Organization, we're working with the Pan American Health Organization, and we're working as part of a trinational team that's on the ground in Mexico, trying to investigate and understand the disease transmission there. We have folks on the ground, and we will be sending additional personnel to the ground to understand this outbreak. Yesterday, the Department of Health and Human Services declared a public health emergency. This is in recognition that this is a serious event, and we are taking it seriously and acting aggressively. But what it also does is it gives us additional authorities. It allows us to move products and dispense drugs in ways that we couldn't before, and it streamlines the process by which the government works. And so it's primarily a reflection of that. It's something that we do whenever we feel that we want to have the ability to move quickly and swiftly. We will be distributing yellow cards at ports of entry. These will provide information on swine flu so that people coming into the United States will have information about this outbreak, what to do if they become sick, what things that they can do to prevent the likelihood that they will become sick. Later today, we will be releasing a new travel advisory for Mexico. This is out of the abundance of caution, and we will be recommending that non-essential travel to Mexico be avoided. We'll also be including in there steps people can take should they need to travel to Mexico during this time. Again, this is out of an abundance of caution. As we learn more, you can look to see our travel recommendations reflect that.